Hello! So, in class, a few days ago, I was talking about this wacky new vitamin D thing that I was kind of experimenting with. And I was trying to get this story of mine condensed down a bit and really couldn't figure out how to. So, rather than taking up too much class time, here I am! Hi! So why don't I tell it here and you can watch it if you want. If you don't want, you don't have to. Keep what you want, toss what you don't need. So here's the situation. It's relatively preliminary new research that's being found that pretty much all people with autoimmune diseases, and there are many of them, have deficiencies in vitamin D. Why? We don't know. Why do autoimmune diseases exist? We don't know that either. So this is where we are. To make a short story long or a long story short, however you want to see it, there is one researcher, a physician in Brazil, who decided to work with MS patients like me on this very situation. And I don't remember exactly when it all started, maybe 3-4 years ago or something like that. I just read a book about this in December, just a little over a month ago. And he started working with some patients who had a lot more severe symptoms than I currently do. I've had symptoms this bad before. They've had symptoms like maybe they've had some sensory symptoms like blindness in one eye, that happens sometimes, or a lack of feeling in some parts of their body, or balance problems, or dizziness, or maybe they have one limb that is really weak or non-functional, and those are some of the problems that I've had. Anyway, those are all things that MS can cause. I've experienced some, or I've experienced some of those in the past. And with their ongoing symptoms, this doctor said, well, hey, let's see what might happen if we experiment with their vitamin D levels. And many of these people have had low serum vitamin D or low vitamin D in their blood for a while. And so he thought, what might happen? Of course, this all sounds a little bit snake oil and wacky, but bear with me on this. What might happen if we increase their dose of like vitamin D supplementation? And he experimented with them a little bit, and a lot of these people over time, this is something that took for a lot of these patients 6 months, 12 months, 18 months to see a noticeable change in their symptoms. But based on anecdotal evidence that I initially read, these people were saying, well, hey, my symptoms are improving, I'm getting stronger, I can walk better, I can just perform daily activities better. There were some people that I'd read about who had gone from not really being able to leave their house because their bodies felt so weak to being able to hike regularly or go to the gym on a regular basis or just things like that, which to me are fairly dramatic differences, right? That sounds like a great improvement. So, of course, I was intrigued, obviously. And so anecdotal evidence is one thing for someone who is a patient with no scientific experience or background to say, well, hey, this is improving me. But it's another thing to see the clinical evidence. So, I mean, people like me with a neurological problem have routine MRIs to on my brain and my and part of my spinal cord to see what is actually going on in the tissue. And these people who had been undergoing this vitamin D therapy, this high dose vitamin D therapy, had actually seen, many of them, some of the regions of the regions where the immune system had attacked their nervous system, which shows up as little white patches. Some of them had shrunk. Now you can see my hand. I'm in front of the camera now. Some of them had shrunk. Some of them had disappeared. So not only are they becoming less symptomatic, but the actual regions of damage were were also starting to disappear. So to me, that's fantastic. And it's, for me, a very good thing. So their symptoms were disappearing. The times their body was flaring up with symptoms were either not happening at all or happening a lot less frequently. So you hear things like this and you might be thinking, well, hey, isn't that fantastic? Why wouldn't someone with this type of illness just, take the whole bottle of vitamin D and dump it down? Why wouldn't someone immediately want to do that? Well, just like with anything, even with drinking water, there can be too much of a good thing. So, vitamin D also has side effects. See how well you can read anything here. I can't fit the whole thing easily in front of my camera and you being able to read this, but if you are in my physiology class, you know some of this. If you're just watching this randomly, then you might not know some of this, but I'll explain some of what's going on here, especially the one at the top. Now I'm just a faceless voice because I'm behind this. But vitamin D stimulates intestinal absorption of calcium and phosphorus. That's one thing that it does. So someone taking higher doses of vitamin D is at risk for more calcium from the food that we eat being absorbed from the intestines. If you have more calcium being absorbed from the intestines into the bloodstream, more calcium in the blood, and that, because our blood is processed by our kidneys, that can put one at a higher risk for kidney stones because you will have more calcium build up in the kidneys. And there are other ways. The points 2 and 3 are other means by which vitamin D over here will release more calcium into the blood eventually. Stimulate parathyroid hormone dependent reabsorption of calcium in the renal distal tubule. So basically what that is saying is that more calcium from the kidneys, that's where this is. So it's saying that more calcium will be reabsorbed back into our bodies from the urine as the urine is being processed and formed in the kidneys. So once again, this excess of vitamin D is reabsorbing more calcium into our blood as the urine is being formed. So point 1 brings more calcium into the blood. Point 2 brings more calcium into the blood. Point 3 also brings a little more calcium into the blood. Coordinate with parathyroid hormone in mobilization of calcium from the bone. So what that is saying is it causes parathyroid hormone to become more active. And again, if you have taken a physiology class and studied the skeletal system and the endocrine system, one or the other or together, you realize that parathyroid hormone in times of when we need more calcium in the blood will break down some of our bone and bring more calcium into the blood. So points 1, 2, and 3, this vitamin D will cause more calcium to be released into the blood. So if you take higher doses of vitamin D, you'll have more calcium in your blood. You'll be at higher risk for kidney stones. So points 2 and 3, you can't really correct for that too much. But point number 1, you can help that out by not eating foods that have calcium in them. And that's really what you have to look out for. And so someone going through this therapy will, with a high dose vitamin D therapy, will be monitored on a regular basis, blood work for what's the blood calcium level, what's the blood vitamin D level, and what's the blood parathyroid hormone level. So what you're probably getting out of this is that like I said, I read a book about this in December and I got kind of excited about it thinking, well, hey, I'm a scientist. I'm willing. Experiment on me. Let's see what happens. Because even though my body has relatively recovered from this horrible flare-up that I had back a couple months ago, I still have a little bit of weakness that lingers on my left side that isn't really noticeable if you watch me, but I notice it because it's my body. And so I would like to overcome that if possible, and to avoid any future problems. So I have been working with a functional medicine doctor. I brought this to his attention, and he's willing to work with me on this. And so for the past about week and a half, I've been taking a slightly higher dose of vitamin D. I'm not raising it really high immediately because of all the issues I was just talking about, because I want to be careful of the amount of calcium in my blood and to see if it doesn't, to make sure it doesn't raise my parathyroid hormone too much. So I'm raising it a little bit above the recommended dose and going for a while. And in 3 weeks, I'm going to have more blood work done, and just to check on those factors. And if they're still within the reasonable range, I'll probably up it a little bit more and go for a month there, and then see how things go and monitor it, and maybe find my optimal dose of vitamin D from there. And hopefully, maybe in a year, I'll have another MRI done on my brain, and things will look better. We'll see. So that's the story there, and maybe we could say this as easy as 1, 2, D. Yeah, I'll keep my day job. But anyway, that's kind of how I'm semi-experimenting on myself, one could say, But yeah, experimenting on myself with a physiology background. Let's just say that much. All right. Thanks for listening.